everyone. My name is Dr. Tom Dembinski, and I'm a clinical biochemist with Diagnostic Services Manitoba. One of my clinical areas of responsibility is urinalysis. It is therefore my distinct pleasure, on behalf of the DSM discipline of clinical biochemistry and medical genetics, to welcome you all to the first of a series of continuing education sessions on urinalysis, made possible today by the valued assistance of the laboratory staff of clinical biochemistry at St. Boniface Hospital. Before we start the session, it is appropriate and important to reflect what you, as DSM staff, have achieved in regards to urinalysis service across the province in 2013. Last year, the implementation of new Siemens urinalysis instrumentation was completed at all DSM laboratory sites, referred to as Urinalysis Phase 1. Furthermore, in Phase 1, standardization of urinalysis processes occurred with the adoption of a single CAP external proficiency program for urinalysis and a common approach to SI unit reporting of results at all sites. This would have not been possible without your dedicated efforts as laboratory professionals. In 2014, the discipline priority for urinalysis service is to provide leadership in best practices for the microscopic examination, interpretation, and reporting of formed elements in urinary sediment, referred to as Urinalysis Phase 2. Integral to achieving this goal, and also a prerequisite for its success, is the standardization to fixed volume MLA 20 and 10 microliter pipettes, phase contrast microscopes for all labs, and a single SOP, but separate versions for Delphic and non-Delphic LIS sites. Additionally, the SOP for urinalysis microscopic examination is being revised to reflect currently recommended and simplified CL, SI, and CAP procedures for the examination of urinary sediment. Also integral to the success of Urinalysis Phase 2 is a urinalysis continuing education program, which was identified as a CE and refresher need by many of you and was therefore requested by the discipline. Thank you for the urinalysis topic ideas you have sent in to date. I would like to introduce you to the stars of today's continuing education session.
Hi, I'm Tracy. I'm the mouth.
And I'm Amanda, the hands.
The following are the core procedural steps taken in the preparation of urinary sediment for microscopic examination. The required specimen is 10 to 12 ml. If less than 10 ml is available, write the letter V on the tube. This indicates the volume is unsatisfactory and serves as a visual reminder to add a low volume comment when reporting the results. Microscopic examination will still be performed on most low volume specimens. If the specimen volume is less than 0.5 ml, or if the specimen is grossly hemolyzed, it will be rejected and resulted with an appropriate comment. Microscopic examination will not be performed on specimens greater than 4 hours old. Only the urine chemistry results will be reported with the appropriate comment. Cap the specimen requiring a microscopic examination and centrifuge the sample at 1500 RPM for 5 minutes. After centrifugation is complete, remove the tube from the centrifuge. Using a disposable graduated plastic pipette, carefully aspirate 0.5 ml of the supernatant. Gently discard the remaining supernatant, ensuring the pellet is not disturbed. Dispense the aspirated 0.5 ml of supernatant back into the urinalysis tube. Resuspend the sediment through gentle agitation. This is essential to provide equal distribution of formed elements. Avoid vigorous agitation. We will now prepare the slide for microscopic examination. Using a 20 microliter fixed volume MLA pipette, aspirate 20 microliters of the mixed sediment and dispense onto the glass slide. If the specimen is very turbid, use 10 microliters of the sediment suspension using a 10 microliter fixed volume MLA pipette and multiply estimate ranges by 2. Place a 22 millimeter by 22 millimeter cover slip over the sediment and examine using a phase contrast microscope. The following steps will be reviewed in the next continuing education session. In that session, we will cover the recommended general technique to microscopic examination, interpretation, and reporting of any formed elements present.
This concludes the first Urinalysis CE session. We thank you for your attention. Please direct any related questions, concerns, and topic ideas you may have at any time to my email.